How do you think about this question in terms of how AI and automation will transform healthcare?
Absolutely. I think one of the top important area where I believe AI in healthcare can help is to bridge the healthcare divide that exists between the haves and the have-nots, the developing and the developed countries, and urban and the rural ecosystem, like Robert also mentioned briefly. There are so many women or men, because I work in breast cancer, the first thing that comes to my mind is women. So where they don't have access to screening, diagnosis, because early detection is extremely critical to have a better lifestyle, lower treatment costs, and of course avoid going back to the hospital again and again. So the tools using AI for early detection as point of care with let's say imaging modality, AI imaging, these kind of things will act as additional expertise to the health workers, additional tools to the doctors to not miss an early sign of cancer or cardiovascular disease or even diabetes, because these three are really chronic conditions which is affecting so many women and men, and one of the top causes of deaths as well. So the way I think about AI in healthcare is a tool for the doctor to detect early, a tool to the health worker who can just become a robo-doctor to some extent wherever healthcare facility is not available, right? And so we can get the patient the right treatment at the right time and irrespective of wherever she or he is. So bridging the healthcare divide is where I feel very
Could you tell us a bit more about the actual kind of AI tools that you've developed at Niramai? I mean, I know you have a tool that uses AI to help detect breast cancer early. How does that actually work?
Yeah, great question, and thanks for the opportunity to talk about my startup, which is now 8 years old. The name of the startup is Niramai, Niram.ai, which is basically non-invasive risk assessment through machine artificial intelligence. So the whole notion of the startup came about because I lost two of my very close cousin sisters to breast cancer. They were just 38 years and 42 years of age, and that's when I realized how vast this disease is, killing 2,000 lives every day. And this is one of the most curable of all the diseases, by the way, from a cancer perspective. So the reason for this is late detection and no access to mammographic screening. Just to give you an idea, in low and middle income countries, including India, many countries in Africa, Philippines, China, Thailand and others, the screening rate is 2%, 2.2% to be exact, which is 98% of women are detecting their cancer by hand. This is what we wanted to solve. So we looked at different technologies and we used infrared imaging. It's like a camera like this. We just measure the temperature variations on the chest, and using AI, we convert the temperature map to a cancer health report. We have about 20 different ML models that are working behind the scene to provide the seamless use of AI to just take pictures, frontal, left, right, etc., and convert that into a breast health report automatically with scores indicating the level of abnormality, also explaining where the problem could be so that a follow-up diagnostic workup can be done. So it's a wellness preventive test which is radiation-free, portable, affordable, and most importantly, works for women of all age groups. And that's a fascinating thing for a technologist like me to see real impact on the ground.
I want to ask Geetha you one more question before we close this off. I mean, so we have the US healthcare system, advanced, lumbering, has its own problems. Singapore, advanced but small. You operate in the Indian context, which is obviously a big economy, a growing economy, very innovative, but still, has a long way to go. How does this question of trust and empathy involving AI in healthcare play out in India?
Yeah, great question. So India is a vast country, diverse economy as well, in the sense that when we go to the rural areas, hardly there's any doctor, one doctor for 1,000 families and so on and so forth we talked about. So their use of AI is very much welcome, particularly if we can use it as point of care device, triaging, enabling this preventive or early detection as simple tools for healthcare workers. For example, we've developed this method where it automatically gives a red, yellow, green. A simple health worker uses a mobile, generates the report, and then she knows that when it's a red, she needs to just send it to the district hospital. So this is feasible. And for those of you who want to develop such things, not just for India, now it's in 20 other developing countries, and as well as US, it's useful. But it's important for every indication, you test completely, make sure that it has high sensitivity and specificity, and leave it in the hands of the health workers. It really is important to bridge the gap.